Hi everyone, it's Dr. Karen, the Women's Midlife Specialist, and I've got a video for you here, an assessment of a 56-year-old who is postmenopausal, and her sharing her labs with us is actually a gift to us because every single woman should actually watch this video, and you're going to find out why as we go along. In any event, we're going to call her SR, and she is currently using what appears as Hormone Heaven twice daily, but only at one pump of Hormone Heaven twice daily. Now let's take a look at her lab. She's not using any testosterone, no DHEA, but this is what is very important for you to notice. With only one pump twice a day, her estradiol is on the high end of normal. Now, with this estrogen replacement reference range, they give us a zero point 0.8 to 12 as normal for estrogen replacement. Now, optimal is between 1.3 and 3.3. I find that women generally want to be either a little bit outside, a little higher than 3.3 is where they feel best, or at least on the high end of this optimal range. But ZRT feels that with this reference range here is perfectly normal for hormone supplementation. However, we have to remember that SR is only using one pump twice a day. So this is a little bit high in my mind. Same with the progesterone, though it's normal in the reference range that it should be, and as expected, she has a good progesterone to estrogen ratio. Now, here's another gift she gave us. She tested estriol and estrone as well. And look at these levels. We've got an estriol a little bit higher than normal. Doesn't worry me too much. They have kind of low estriol reference ranges, but this one at estrone is 9.2. Quite surprised about that. There is no estrone in any of Young Hormones products. So, where is this estrone coming from? This is the estrogen we don't want. So, is she not metabolizing her estrogens very well? Is she not clearing her estrogens very well? Is she producing her estrone from her fat cells? Well, she has a BMI of 29, and that is at the highest end of being overweight. Anything greater than 29 is considered obese. So this is a possibility. I'm not going to hang my hat only on that. We simply can't, though losing weight is definitely going to improve her estrone level. This is something that we can't hang our hat completely on. One more thing before we move forward and see what we're going to do for SR is let's look at her testosterone of 16, which is at the lowest end of normal. She's not on any supplementation. And here's her graph of down here. These estradiol and progesterone don't show because they're above the optimal reference ranges is what ZRT gives us a graph on. So let's look first at her symptoms before we go any further. Excuse me, I had to take a drink. Okay, now this is very interesting because SR really only rates one thing out of all these symptoms as severe, and look what it is. Hot flashes. So she's actually got her worst symptom of hot flashes, which is an estrogen deficiency symptom when we know her estrogen levels are actually high. So what can cause that? When we look at the other one, she doesn't have a whole lot of symptoms in the moderate range, so I question my thought. My first thought is, well, is she one of these calm individuals that, can stay very steady and then possibly have little periods where she kind of blows? There's a lot of us like that. We stay very good and then all of a sudden our top blows off. And if that's the case, then does she hold in stress, and elevated cortisols and adrenal dysfunction definitely increases estrogen. Low thyroid can increase estrogen. So if we look down here at her, the combination of symptoms, she's really indicating still estrogen and progesterone deficiency as her most common complaint. The second most common is high cortisol. The third most common is low androgens, which does go along with a low testosterone, and then metabolic syndrome as the fourth one. And that certainly may be playing a factor with a BMI of 29. Okay, so we don't get a tremendous amount of information except this here, that hot flashes and night sweats are her biggest complaints, even though her estrogen is high. So hang in there. I'm going to give you a little hint about that before we're done. Okay, let's continue with assessing. We're not in the what to do phase yet, but here's what certainly appears to be happening, that SR is obviously not clearing her estrogens well. And this is extremely important because if we don't clear our estrogens well and our estrogens build up, that puts us in a higher risk category for breast cancer and ovarian cancer. So this is why I'm saying every woman should watch this video. All right, so where is this coming from? What are we going to do? We've kind of already talked about it a little bit. It could be coming from this BMI that's elevated. It could be coming from elevated cortisols that are happening. She didn't do cortisol for us. That's a possibility. But she would have to be one of those individuals that kind of holds things in and kind of downplays everything and then has intermittent blows. That would have to be the case. And we don't know that. So, and she mentions that fatigue is only minimal and stress is only minimal. So I'm not going to hang my hat on that. I've got to look at other things that could be causing this. So what are we going to do for SR? Where are we going to hang our hat? And how are we going to help her not only balance her hormones, but also put herself in not only a balanced state, but a very safe place to be for the rest of her life as well? Okay. The first thing we're going to do is long-term estrogen. Now, she's using a tiny little bit of estrogen and the estrogen levels pop up like that. So we're really talking about long-term estrogen, which is an aromatase inhibitor that I'll remind you about shortly in another chart. I have a slide for that. But 2 capsules once daily or 1 capsule twice daily long term is going to be very important. Now, if it's correct that you use only 1 pump twice daily SR, I want you to stop the hormone heaven and go straight to hormone support. Hormone support only has estriol in it. Until we see you clearing these estrogens well, hormone support is going to be the product for you. We don't want to add any more estradiols because estradiol can have some conversion to estrone, but estriol cannot. Estriol is the end of the line and our safe estrogen, whereas estradiol is safe at proper levels, but if you get too high, we're going to be pushing this over to the estrone, and we don't want that. So right now, hold on to your hormones heaven, and let's switch to hormone support. Okay, now let's talk about clearance, how to clear the estrogens from the gut with the addition of estrogen, but let's get this gut healthy. Let me remind you first where this estrogen is working. It's working in 2 places. It's aromatase inhibitor where testosterone converts to estradiol, and this androstenedione, here's your aromatase inhibitor, converts to estrone. These are coming from DHEA. Now look how testosterone can also convert back to estrone androstenedione, and androstenedione can convert to testosterone. And here's where estradiol can convert to estrone. Estrone can convert to estradiol. These both can convert to estriol, but estriol cannot convert to estradiol or estrone. So that's why we're switching over to hormone support. So this estrogen does an additional benefit that also helps your body push the estradiol and estrone into your safer metabolites. So that's where the estrogen comes from. Now, what else are we going to do? We need to clean up the gut. So we need to improve the elimination of the estrogens through the gut, because our detoxification systems come through two parts of our body, the liver and the gut. Now, of course, the lymphatic system as well, but we're talking about elimination of toxins, we're elimination of medications, elimination, and we're not just talking about estrogens. We're talking about xenoestrogens. That's something that we need to think about. Xenoestrogens, those estrogens that we get from PCBs, glyphosate, which comes from Roundup and pesticides, all of the toxins that we bring into our body that are on our food or that we get through air that we breathe, or toxins that we put on our skin, those are detoxified through the liver and the gut. And if these are not working properly, they're going to be sluggish, and you're not going to detoxify like you would be if they were working well. Now, with a BMI of 29, the liver could become fatty. So fatty livers are sluggish livers. They don't detoxify as well. So that's why we'd love people to lose weight, get their BMI below 25. And so that's why people who are overweight have higher risk of cancers. They do not detoxify as well. Their livers can become fatty. Now, that's the liver. Now, let's talk about the gut, because the gut is the second place. There's phase 1 and phase 2. Phase 1 is in the liver, and once the liver breaks down toxins, it sends it to the gut. The gut does its detoxification and eliminates it through our feces. So the gut is a very interesting organ. And you think of the skin as having 7 layers, excuse me, of 7 layers thick, whereas inside the gut, we're only one single layer thick. And this single layer is connected, one cell to the next, one cell to the next, is connected through these very tight junctions. And when the gut becomes unhealthy, these junctions open up and toxins can seep out of the lumen of the gut and seep through these cells and into the bloodstream. Now, this can happen, when you cut yourself, you can see swelling around the cut, and that's what happens inside the gut. If your gut becomes unhealthy, it gets mushy and boggy and inflamed, and these cells start to separate from each other, and this is what the layman's term called leaky gut, an inflamed leaky gut with these toxins getting into the bloodstream. And this can cause malabsorption of nutrients. Excuse me, it can cause autoimmunity such as Hashimoto's, this food intolerances, and even systemic inflammation like pain in joints and muscles, and also there is something called the gut-brain axis, which we haven't even talked about, and this is critical, but it can cause abnormalities in your mood. So it can cause anxiety, depression, irritability, insomnia. So a healthy gut is vital to clearing toxins, and when it's not healthy, this single layer of cells can become mushy, open up, and allow these toxins to get in, preventing you from clearing toxins, including clearing your estrogens. So one of the things that I'm recommending is this product right here, GlutaShield. GlutaShield is very high in glutamine. It's got 5 grams, which helps tighten these gap junctions. Now, in addition to that, I really want you to consider a full GI cleanse with this GlutaShield. However you do your GI cleanse, there's many different ways to do a GI cleanse, and I know that you know somebody who's very successful in actually resolving her Hashimoto's through a clean diet and through GlutaShield. I believe she uses GlutaShield. I hope she does. And GlutaShield will help you get to this state much faster. So glutamine is critical in keeping these junctions tight. I use GlutaShield every day, and I don't have any autoimmune disease. I don't have any allergies. I'm just no food intolerances. I'm just really kicking it good, but I keep a very healthy gut. So GlutaShield is our first thing that I'm going to recommend to get this gut healthy. Now, while I'm here, I put it on this slide, and I really should have put it later, but I also, to bring this testosterone up and also support your immune function, I'm highly recommending go ahead starting on DHEA 5 milligrams in the morning for a month, and then increase it to 10 milligrams, and this is going to help boost your testosterone, which is at the lowest end of normal. Now, let's move back to the gut, because I'm really not done with that. Let's look at this. Nutrient malabsorption, very common with a leaky gut. Now, one of the things that is bothersome about that is when we are detoxifying our estrogens. Our estrogens have metabolites. Most of them are safe metabolites, but there are several metabolites of estrogens that are not safe, that increase our risk of breast cancer. And here is where GlutaShield helps convert problematic estrogens into inactive estrogens and then excrete them through this enzyme here, GSH transferase. This is where GlutaShield is also helpful. Now, there's another pathway system called COMT, C-O-M-T, COMT is what it's called. And this is critical for getting rid of the most dangerous of all estrogens, which are called quinones. Those estrogens that are not converted into our healthy or protective or inert estrogens, inactive estrogens, and then excreted through the gut, that are not through this COMT system, are converted into quinones. And this is what is dangerous. You have to have a very good methylation system, as well as a full nutrient support. All of our B vitamins, our vitamin C, zinc, selenium, these are very important to have a high functioning enzyme system in order to convert these estrogens into inactive estrogens. So I'm going to highly recommend that you use a supplement, a comprehensive nutrient supplement. This is the one that I recommend. It's the least expensive that I can find that has the right stuff at the right types of nutrients, not the cheap synthetic forms, but the excellent forms that our body actually makes. This, through Life Extension, is the one that I have found. I was just at the American Academy of Anti-Aging. I searched for all of the nutrient packs. I can't find one better than this. Okay, so now we've talked about supplementing with DEM. We've talked about supplementing with DHEA, GlutaShield, nutrient packs. I've got you going, girl, but I've got you covered because this is a complicated situation. All right, now, one last comment about estrogen deficiency symptoms: hot flashes and night sweats, even though you have high estrogens. I want you to think Also, that low thyroid could be playing a role. You don't have a lot of symptoms of low thyroid, but you also tend to have, kind of a low reporting of most everything. So I don't know if you just downplay everything. So make sure you test your thyroid, that TSH, free T4, free T3, reverse T3, and TPO, that thyroid antibodies. Okay, in addition to that, I want to remind everyone that high estrogens can cause the same symptoms as low estrogens. So, SR, if you were having hot flashes or night sweats or both before you started hormone heaven, and then you went through a period where you were rather feeling pretty good, that things were way improved, less hot flashes, and then all of a sudden you started having them again, this is an indication that even that dose, one pump twice daily, is too much. And you actually went from low to good to high. So that's something I would love to hear from you about. Send us an email, a private email, and let me know if that's the case, because that's something to consider as well. Okay, so since this was so complicated, I want you to go back over and over. This is important, guys, and we are going to move into estrogen metabolism this year, and we're going to move in to urine testing of estrogen metabolism, and going to give you an opportunity to test your estrogens through the urine, and you're going to want to know how you're doing with this. And so this is really critical. This is probably one of the most important uh, uh, videos that I've done so far. So I want to tell you, you can do it. I want you to do all these things. Retest in 3 months, the same exact test. Or you can add the cortisol, you can add the DHEA, but at least do the same ones that you did this time, the estriol and the estrone. I also want you to consider doing that urine estrogen metabolite test in the future. Wink, wink, what I just talked about. And here's the overview again. That Gluta Shield, 1 scoop a day. Try to do it most days. I try to do mine most days. There's some days I miss my shake. It's actually delicious. I use the chocolate flavor, and it's actually quite good. You can ask your relative who's very, very successful with this. Ask her how it tastes. Absolutely delightful. Do this GI cleansing diet, just pick her brain, go for it. Let's switch to hormone support. Hang on to that hormone heaven, because I intend to help you get these estrogens really nice and highly balanced. We want that DEM, diindolylmethane, 2 caps daily. Get those cruciferous vegetables up, that comprehensive nutrient support so you can get those B vitamins and folic acid and minerals at optimal levels, and that DHEA as well. Okay, I hope this helped you. I know it did, and I know it helped a lot of other people too, and I appreciate you sharing your labs with us. And I also really want to say thank you, and I can't tell you, I have to be honest, I had to do your video 3 times because I kept messing up on it. And I had gotten to the point where I wanted to actually just cry a little bit. But I'm so glad I kept doing it, kept plugging away, because I think that this one is going to help so many people. And I also think that this is critically important. So give me a thumbs up and share this with your friends. Tell them how important this is. Yes, it's a little long, but it's worth it because you're worth it. Okay, take care, and I'll see you soon. Bye-bye.